Welcome Family Time on ABN TV, your viewing of choice this afternoon. We promise to make it worth your while. We're starting a new discussion on erectile dysfunction, and we will be dealing with questions that you've always wanted to ask, but we're far too embarrassed to do so. Do not despair. Help is at hand in the form of these doctors. We have with us today on our panel Dr. Ernest Ahiaku, who is a consultant urologist at Gwynneth Hospital in North Wales. Welcome, Doctor.
Thank you very much.
We also have his wife, Dr. Na Ajele Bano Ahiaku, who is also a GP and a specialist in palliative care and primary care in North Wales. And we also have our very own Dr. Cann, who is also a general practitioner and a partner in the GP surgery in Kent. Welcome, Dr. Cann.
Thank you, Nana.
Well, what's erectile dysfunction, Doctor? We'll start with you.
Erectile dysfunction, simply put, it takes two to tango. For sexual gratification, both partners should be satisfied at the end of any sexual encounter. If one partner in that relationship is not satisfied, then there is a problem of erectile dysfunction. But basically, if we look at erectile dysfunction from the male perspective, it can be defined as the inability either to achieve or maintain an erection long enough to satisfy both partners in a sexual encounter.
I see.
Yeah. So that could either be due to the fact that you don't get an erection, or the erection doesn't last long enough to satisfy both the man and the woman.
Thank you. And why is it so important that we take this seriously?
As my wife put it, sex is the glue that holds a relationship together. That's one reason. The second reason is that for a man who begins to have erectile dysfunction, we need to start thinking, is there an underlying problem, which is what's causing the erectile dysfunction? Because there are a whole host of medical problems that could be leading to that erectile problem. And we find that when you investigate such people because of their erectile dysfunction, you will be picking up a lot of medical problems that could be treated, which would improve not just the erectile dysfunction, but improve the general health of the gentleman. I
see. Well, Dr. Najeli, what does the importance of a healthy function, if I could put it that way, is to the family as a whole? What would you say?
Let us also not forget, in the Bible, we are commanded to come into the world and multiply. This is the way we multiply, by having sexual encounters. We want to have healthy children, so we marry well and we have children who we hope will continue to be healthy. People get unwell as time goes on in life, and one needs to pay attention as you get older to some of these diseases that can affect your sexual function. But primarily, if you've never had problems growing up, there shouldn't be too many problems, but they're congenital diseases which may contribute to your being unable to reproduce. And that's one of the reasons it's quite important to address this and not just see it as a disease of old age, but a disease that spans life.
Yes, thank you. And it's something that doesn't just affect a man, is it? It affects the whole family as a whole, because if a man doesn't function properly in the bedroom, it's going to have its stresses and strains on the wife and the relationship as a whole. Yeah.
In fact, there has been a study done in Sweden and one in South Wales, in Cardiff, where they looked at the longevity of men, or the survival of men, and it's found that men who have more than 2 ejaculations a week survive 50% time longer than men who don't have it.
Really?
Yes. And they've also found out that the wives of men who don't have regular ejaculations also tend to die quicker than the wives of men who have regular ejaculations.
So there's a big message to the family then.
Well, to have an erection which is fit for purpose, for want of a better phrase, you need blood rushing into the penis to lead to engorgement. But before that can happen, you need signal from the brain going down the spinal cord saying that it's time to go to bed. I feel like having a sexual encounter with my wife tonight. The signals come down, the blood vessels open, the heart pumps blood into the penis, and then you get an engorgement. So anything that leads to a reduction either of the sensory impulses from the brain coming down into the pelvis, or leads to a reduction of the amount of blood that can rush into the penis, then we've got a problem with erectile dysfunction.
Okay.
And that is why any disease that leads to either problems with your vessels, problems with your nerves, problems with your psychology, that can lead to having erectile dysfunction. We also know that there are men who have problems with what we call in our medical parlance touch and go, which is also referred to as premature ejaculation. As we said, you need to satisfy both partners in the relationship, so that if a man is ejaculating as soon as he has penetrative sexual intercourse, as far as the woman is concerned, this is erectile dysfunction in the man.
I see. Okay, thank you. Before we go into the details of the causes of it, perhaps looking at the community, because Dr. Cann, you're a GP, so you will see a lot more at the first stages of it. Do you see a lot more of these things?
It's quite common, as Dr. Ahiaku rightly said, that when we talk about erectile dysfunction, there's a range. Some people think that as soon as you say erectile dysfunction, they think about impotence, but that is not just it. Borders from the inability, complete inability to get an erection, and then there are different degrees. Somebody might be able to get it up, get an erection, but cannot sustain it. Somebody can sustain it, but it's not firm enough to have penetrative sex with a partner. It is important, as they've said, that we talk about it, because it is common. Most people have this perception that it is a disease of old age. It is not a disease of old age, even though statistically, the older you grow, the more likely you are to get in it, by reason of the fact that as a man grows, one, your libido goes down, two, your testosterone is going down anyway, so your libido will go down. The stresses of life in middle life from the age of 40, and that is why if you read the evidence online, it will say that the majority of patients are above the age of 40. And let me add also that it's a bit easier for those that are a bit older to come in, because everybody expects that as you grow older, maybe the function goes down a bit compared to somebody who is a bit younger. And as Dr. Ajele said, that it is the glue that does what? Cements a relationship. Yes. So imagine that there is the problem that is at home. The man finds it difficult to seek a solution to it, even though there might be a solution to it. Then you have all kind of chaos at home. So it is quite important to talk about it. Dr. Ahiaku also mentioned the fact that most of the time, it is not even just the absence of the erection or the difficulty in getting an erection, but it may be the first sign of a very serious medical condition that we probably would talk about.
Dr. Ahiaku, could you tell us a little bit more about what you do? Because I think the first port of call is these two. You're the general practitioner. Yeah. So if somebody has a problem, you first go to your GP, and thereafter I think the person is referred to you. Yeah. Could you tell the viewers a bit more about what you do?
Well, as you rightly said, the majority of people who have erectile dysfunction would first see their general practitioners. And most general practitioners will try to find out, is there an underlying medical condition that is leading to the erectile dysfunction? Because we know that erectile dysfunction precedes heart attacks by 10 years.
Yeah.
Oh, I see.
Yes.
Gosh,
because
that's interesting.
The diameter of the artery to the heart is 3 millimeters. Now the diameter of the artery to the penis is 1 millimeter. So if the arteries are getting blocked, you will block up the artery to your penis first, and 10 years down the line, then the artery to your heart gets blocked. So when the general practitioners see these patients, they try to exclude things like diabetes, hypertension, high cholesterol levels, and being overweight. When they've sorted this out, they try to find out, have they got problems with their testosterone levels? If there is no serious reason to refer these patients into secondary care, they are treated in primary care with the use of medication.
Oh, I see, okay.
If the primary care physicians are unable to deal with the patients within primary care, then they get referred to see a urologist who will then take it a step further by giving them different other forms of management options that are open to such people, and that is where we come in.
I see. So you can, as a GP, you do actually treat erectile dysfunction?
Yes, we do.
Yes.
You do? Okay.
We do. Sometimes people are suffering with anxiety or depression. Sometimes it's related to excessive alcohol use. And these are issues we deal with in primary care in the first instance. We try and get people to change their lifestyles, and sometimes after doing that there's not very much change, in which case you need to be seen in secondary care, because they're also able to do slightly more invasive tests. Sometimes it's due to a nerve problem. We don't have the facility in primary care to check on things like that.
Yeah.
But we shouldn't forget that there are people who are also born with medical conditions like spina bifida,
Okay.
or some of the neurological diseases which will lead to erectile dysfunction. And those are people who would have presented normally before the age of 40. So sometimes they're already in secondary care services.
I see. Okay, that leads us beautifully onto the subject of the causes of erectile dysfunction. What are some of those?
Broadly, you can divide the causes of erectile dysfunction into psychological or organic in that you can actually find a cause for it, or a mixture of psychological and organic. Briefly, what a psychological erectile dysfunction. Let's assume that you've got a young man who is found a pretty young woman, and they get into a relationship. In his anxiety or in his effort to try and prove how much of a man he is, he gets into what we call a choke system, where there is so much adrenaline being pumped around because of his anxiety to perform. And so you end up with what we call a performance-related erectile dysfunction. It isn't that he's got difficulty with erections, but in his bid to outperform himself, he's unable to perform. So that's what has happened.
Yeah.
And if he's not strong enough to snap himself out of that situation, the next time he's going to get into a sexual encounter again, he begins to think of what happened the last time, and he says, is this going to happen again? Oh dear. And then he gets into what we call a self-fulfilling prophecy. He gets into a vicious cycle, and every time he thinks about it, it happens. He has a problem with it. And such people need to go and have psychosexual counseling. So that is one example of psychological erectile dysfunction. Another situation where you may have what we call psychological erectile dysfunction is where a young man, married, he's gone either to a conference or he's gone out of town, and he's had too much alcohol, and he sees a strange woman, one thing leads into another, and he finds that himself having unprotected sexual intercourse, and he wakes up the next morning and he thinks, God Almighty, what have I done? What diseases have I picked up? What diseases am I going to transmit to my wife after having had this one night stand with a complete stranger with no protection. So he gets home, and when his wife gets close to him, he starts to worry, am I going to pass something on to my wife? And so he has a problem with getting his erections, and that's another cause of psychological erectile dysfunction. Then we've got a situation of organic causes of erectile dysfunction. We've got the medical conditions where we've already talked about diabetes being one of the biggest causes of erectile dysfunction, followed by hypertension, high cholesterol levels, and obesity. Those four things, which I refer to as the bad quartet, lead to erectile dysfunction. A lot of people are on treatment for all sorts of things, and medication can cause erectile dysfunction. I'll leave that to Dr. Ahiaku and Dr. Cann to tell us about some of the medications which patients take without realizing that they can lead to erectile dysfunction. Because if we know that that's what they're taking, sometimes changing the medication can improve the situation. I'll let them, the two of them, talk about this.
Right. There are several medications, and many of us take medications for various reasons. I'll start with the very simple ones. If you take something like antihistamines for allergy treatment, some antihistamines taken over a long period of time have been noted that it can affect cause erectile dysfunction.
That's interesting because it's very commonly used.
Very commonly used. Very commonly used. You take medications such as blood pressure medication. There are some blood pressure medications. The typical one is what we call the water tablet, diuretics. They have a way of affecting erectile function as well. There are other medications called the beta blockers that we commonly use to treat high blood pressure as well as heart problems. They can cause erectile dysfunction. And then you've got the anticonvulsants used for treating epilepsy. They can also cause erectile dysfunction. Now, on medications, let me mention something about steroids. You know, we do have people who love to bodybuild as well, using all kinds of steroids to enhance muscle bulk. Prolonged use of steroids have been noted to also cause erectile dysfunction.
So you have the body, but then...
Well,
you have the body, but you don't really...
Well, isn't it interesting that somebody portrays us having an 8-pack that is 6 year plus the pecs, an 8-pack looking very huge. But incredibly enough, after all that pumping, there is nothing happening below. Nothing happening below, so the performance doesn't go with the structure, basically, but it is a problem. So there are so many other medications, as Dr. Ahiaku said. Once you come to primary care or see your GP, we will investigate all that. If it is a medication that is doing that, sometimes all we have to do is take the medication off, and you see the performance improve. He also mentioned about certain neurological conditions that Dr. Ajele mentioned as well. So I think that when you started, you said the signal leaves the brain, and then the blood rushes to the penis, and then you get an engorgement. So anything that affects the signal, that's right, anything that affects the signal from the brain through the spinal cord to the penis would cause a problem. So the conditions like stroke, Parkinson's disease, any problem affecting the nerves can also cause that problem as well. And then in general practice, he mentioned the psychological bit as well. Ordinary stress. I mean, we all lead very stressful lives. You've hit 40, in your mid-40s, business is booming, high flying, have no time really. Unfortunately, at that age, your testosterone level is also going down. Coupled with the stress, your drive goes down. You find it very difficult to even get an erection or maintain an erection. So just a simple change in lifestyle in that area could, making yourself less stressful. Anxiety, depression has a way of reducing the sexual drive as well. Emotional problems as well. I think it was interesting he mentioned somebody meeting a woman for the first time. And sometimes you realize, if somebody comes in, for example, one of the questions is, are you getting early morning erections? Yes, I'm getting early morning erections. When you meet a new partner, do you get an erection? Yes, I get an erection. That is a good test to see whether they really have true erectile dysfunction or maybe there's an underlying problem. If, for example, the person is not getting any early morning erection at all, you know there's a real problem underneath it. So there are so many things that we would look at. Again, alcohol is a killer. Abusing drugs, cocaine, amphetamines, heroin. Some people say that initially it may give a thrill, but prolonged use of it would affect the function as well. Yeah. So, yeah.
The other thing is that they tend to use testosterone as well as a bodybuilder, and too much testosterone, you begin to get a negative feedback in using too much testosterone. We do use testosterone sometimes in treating people who have erectile dysfunction, which is secondary to low testosterone. But if you overstimulate the body with testosterone, your own testes stop producing testosterone.
I see. Okay.
And because your own body has stopped producing testosterone, once you go off the external testosterone, the testes have given up on you.
Right.
Yeah.
I see. So that's how
it works. Yeah.
Dr. Ajele, I'll ask you this question. What are some of the myths that you've heard about sexual functioning in men? Myths about sexual functioning in men. There's a lot of them about.
There's a lot of them about.
I purposely asked the lady, bro.
I think Dr. Ahiaku is probably better to tell us about the myths.
Yeah, because I mean we live in a community where there's lots of myths about male sexualities and
I mean, people worry about the size of their penis.
Yeah.
I mean, God in His infinite wisdom has created the penis and the receptacle for the penis in such a way that when the female organ is not being used, it is small, but it's got elastic tissue and it's expansile and it can expand to accommodate whatever organ is being used within it. So the size of the penis, by and large, doesn't matter. Most penises in the erect state are within 2 standard deviations. I don't want to mention any sizes, but there is this belief.
I was going to say, don't mention any sizes.
But there is this belief that the bigger your male organ is, the better it is. The size doesn't matter most times. How you use it is more important than the size, and you will probably find that too much of it means that you don't have enough blood going in.
That's right. Yep. Yeah.
To keep it up for long enough. And people believe that certain alcohols like Guinness gives you staying power.
Yeah. Alomo bitters.
Alomo bitters.
Yes.
And,
the young men are very fixated on it.
It's all the matter. It's all in the mind, because you've had so much alcohol. The man may think that I've taken this and I'm really performing, and the woman is thinking, what is he doing? Because the alcohol has dulled your senses, and you think that I'm really being an Italian stallion, when actually you don't. So these are some of the myths that certain alcohols can actually lead to increased sexual performance. There are certain roots which I must admit, which you find in our forests, which do work. They work both as aphrodisiacs and also in maintaining erections. I know this for fact because I did forestry for a year before I went to sixth form, and there was this route which all the forest rangers swore by, and later on I found out that yes, it's got the properties of increasing sexual performance.
By trying it yourself, you mean?
Cheeky. Very cheeky indeed. At that age, I didn't really need it. We're talking when I was 21.
Yeah. What is it? Are you going to disclose it to us, or?
Well, I can only remember the botanical name. It's called Paulina pinnata.
Oh right.
It's a root. I couldn't identify if I saw it now, but when I was in forestry school, we could identify it was called Paulina pinnata.
I see.
So some of the other myths that need to be
debunked
is that you need to be able to maintain an erection for
30 minutes, half an hour, 45 minutes.
So a lot of men come and sit in the pub and talk about their sexual prowess, but most of the time they're always showing off.
Yeah.
That's a good note to stop on. It's a sad note to stop on because I was quite enjoying myself. Sorry.
It's okay.
We'll be back. I think this is the end of our first series. We'll be back with discussion. We'll carry on from where we're leaving it now.
Okay.
The various myths which men discuss and things affect makes them more men than not. Thank you very much for joining us on Family Time on ABN TV today. I promised you, didn't I, there's going to be an interesting discussion, and it is. So stick with us as we carry on with our discussion on erectile dysfunction. This is a show you definitely can't afford to miss. Thank you, though, for joining us on Family Time on ABN TV.